thank you for this nice question, Marcus. I think that nowadays the hepatitis C in prison is not a problem, at least in Spain, because treatment is widely available. What I would say, rather than that the hepatitis C spreads in prison, I think that the prison is a place where these kind of infections can concentrate because of the own features of this special population. Usually they are have disease addictions, they have severe mental disease, and all of this background in this special population makes that hepatitis C has high prevalence. Maybe in some countries where the prevention availability of programs is not as wide as in Spain, the spread of the infection within the prison is more or less easy, no? Isn't it? But yeah, I think in Spain, the problem is that this kind of population is their own features makes that these people concentrate this kind of infections in the prison. I think that's the best answer to this question. I think the main issue in Spain, or a special feature in Spain, is that we developed in 2015 a national program to tackle hepatitis C. And there, at least in prison, one of the main focus of this program, this microelimination population, to target the treatment and all the things you need to decline the infection in prison. So making this treatment widely available in the prison and also for the general population makes these targets like a reality in Spain. Also, I think the main important thing in prison is to have harm reduction programs available within the prison, widely available for the inmates. That makes the incidence within the prison go very slow or very low. I think, I don't know how exactly generally work in prison, but I think one of the main reasons that why the health system within the prison is working very good is because we believe in the reintegration of the inmates. So there, if we provide a good health care, we think that the inmates will reintegrate with the general population in a better way. So once an inmate is admitted in prison, the screening for several blood-borne viruses is widely available. So as soon as they are diagnosed, they are treated. So this makes more easy for us to decline the incidence of the infection. And also within the prison, as I said before, the availability of harm reduction programs like opioid substitution therapies, needle and syringe exchange programs, and also the close attention for the addictions or severe mental diseases is also available, makes that the reduction of these infections go very low. Yeah, let me start the answer of this question by the end of the sentence is that I think the DDA treatment now is not quite wide, expensive at all. All the governments has hardly negotiated with the industry and the labs, and I think the price is not as expensive as it was in the past. So that's one of the main things I would like to say. And then the one who is in charge of the healthcare of the inmates in Spain is the Ministry of Internal Affairs. The secretary, the special secretary for the healthcare in prisons belongs to the Ministry of Healthcare. Sorry, the Ministry of Internal Affairs. But then the specialist attention belongs to the Ministry of Healthcare of the nation, and then within each region in Spain have their own healthcare. So from my point of view, we are the ones who are in charge to prescribe the treatment. And then sometimes as the development of the DDAs have evolved quite quickly, sometimes the prison end didn't have the DDAs available. So this treatment was provided by the regular healthcare. and then it was also invoiced to the Ministry of Internal Affairs. Now, I think there is a clear collaboration between both ministries, and they support not also the treatment, but also the medical attention from the prison end, and also the specialist end, and also the availability, the harm reduction programs are within the prison setting, the prison end. Yeah, I think it's occurring, but the incidence is pretty low, as I said, because we treat the patients as soon as they are diagnosed in the prison. But as I also show in my presentation, this is like a very dynamic system where the inmates are pretty quickly sometimes transferred to another prison, or they are quickly released. So sometimes it's difficult to reach this population to start treatment as soon as possible. As also the harm reduction programs that started with the HIV epidemic in the past. So we take advantage of that programs with it for hepatitis C is the key for reduce the transmission. I think, in my opinion and my experience, at least during my the study I show in the background in the presentation, the jail-free C program, we didn't found any reinfection. But I must say that later on, after we finished the study, we had a reinfection, but outside the prison. So I think the main issue regarding reinfections or incidence of the infection within the prison is the availability of harm reduction programs and the attention of the comorbidities of these patients that should be continue when they are released. There is where we find the reinfections when they are released from prison. We have to put our view in this setting. I think that's what our data says, but I think that it's not completely true because of that the system is quite dynamic. So sometimes, as the data collection is done pool during the time, sometimes the data is like overlapping some numbers, and that's maybe some proportion are quite high. But at least once the patient is diagnosed and the stay in prison is over like 30 days, they are treated. So it's in this way it's very easy to manage this population. But what we find some difficulties is when they are releasing quite quickly and we know we cannot engage them with the treatment or health attention in a global way. But at least all the patients that are having a long stay in prison, they're perfectly managed by the medical staff in prison and also supported by the specialists at the hospital. If I may say something more, the clear feature of our prison setting and the hospitals is that we think the inmates should have a very good health to make him possible their reintegration. So if you make them feel comfortable with the health, it's easier for us to reintegrate them. And also I must say we are running another program to eliminate hepatitis C in those patients, those inmates or people that they are sentenced do not have to be served in prison, and they have to check in what we call the social insertion center. We are also screening them in the same day. We perform antibodies. Then if the antibody is positive, we perform gene expert for hepatitis C in a finger stick. It takes like 2 hours, for example. And then they call us, and through a telemedicine consultation, we start the treatment in the same day. So this like quick disease diagnosed and treatment instantly then, we found that it's feasible for them to complete the treatment and also eradicate the infection in these special features, pretty close to the inmates in prison, but with some differences. And the way of management the infection out of prison in a similar population should be done with this model of care. Thank you very much for your invitation. I hope you find it interesting.